back to this video lecture series for ethics. In this video, we're going to continue our discussion of James Rachel's famous article, Active and Passive Euthanasia. Now, you'll recall in that article what Rachel's attempts to accomplish is to refute what he calls the conventional doctrine of euthanasia. And what is the conventional doctrine? It simply says that while active euthanasia is never acceptable, it's never acceptable to directly take the life of a patient through, for instance, administering a lethal injection. While it's never okay to do that, it is at least sometimes okay to engage in passive euthanasia. And you'll remember, we define passive euthanasia as bringing about a patient's death either simply through doing nothing. So there's some surgery or there's some treatment you could pursue, but you simply don't do it. Or by withdrawing artificial means of keeping a patient alive, such as life support. So the doctrine just says, active euthanasia, never allowed to do that. Passive euthanasia, you are at least sometimes allowed to do that. And so the first question we should ask is, well, what is the reason for this difference? If we're going to say that we can never engage in active euthanasia, but we can in passive euthanasia, then there has to be some difference between the two that explains why we're treating them in a different way from a moral point of view. And I told you that we're going to consider two different justifications, two different ways of drawing a moral distinction between these kinds of euthanasia. So one justification comes from what is known as the doctrine of double effect. And the doctrine of double effect is going to tell us that, well, the reason active euthanasia is wrong is because it intends the death of the patient. But when we engage in passive euthanasia, we're just engaging in an action that merely foresees that the patient is going to die, but does not intend it. I'm going to table our discussion of the doctrine of double effect to the next video, because in this video we're going to look at a different doctrine, which could also be said to support the conventional doctrine of euthanasia. And that is the doctrine of doing and allowing. So what does the doctrine of doing and allowing say? It says, well, look, if you're going to do some bad thing or bring about some bad outcome, it's worse to do something that brings about that bad outcome than merely to allow the bad outcome to happen. So, for instance, think of the example we said last time. You might think it's morally wrong to not give to charity, right? We've seen that some philosophers think that. But even if you do think that, you might say, well, look, even if it's wrong to allow someone to die by not donating resources I have that could save their life, it's worse to directly kill them. And if you think in that way, then you're thinking along the lines of the doctrine of doing and allowing. It's worse to do something bad than it is to merely allow something to happen. And how would that be applied in this case? Well, if we're saying that the conventional doctrine relies on the doctrine of doing and allowing, then the idea is that active euthanasia would be a doing. It would be an active action in which you take another person's life. But passive euthanasia would just be allowing the patient to die. And if a doing is always worse than an allowing, then that would explain why active euthanasia is worse than passive euthanasia. In any case, that is the conventional doctrine, and as we're going to see, that is the reason that Rachel thinks that many people think the conventional doctrine is true. It's because we sort of have this intuition that it's worse to do something bad than to allow something bad. And what we're going to see is that Rachel is going to attack that intuition. More specifically, first, he's going to tell us that the AMA statement we looked at last time relies on the doctrine of doing and allowing. Right, that statement we read, which says it is never okay to intentionally take the life of a patient, but you can remove extraordinary means of treatment. That statement assumes that the doctrine of doing and allowing is true. And so what Rachel is going to tell us is, well, look, actually the doctrine of doing and allowing is false, so we should reject what the AMA statement is saying, and we should realize that he says it is forcing an immoral doctrine on doctors, physicians, and healthcare providers. Now, in order to make this case, Rachel relies on what I'm going to call the same reasons argument. So let's take this a step at a time. Let's look at each of the premises. Premise 1 of the same reasons argument says the following. P1, it is at least sometimes permissible to bring about a patient's death through passive euthanasia. So the place that Rachels wants to start with this argument is not thinking about the more controversial cases of using a lethal injection to bring about a patient's death. He just first wants us to take a look at what we've been calling passive euthanasia. And he wants us to think critically about what are the reasons that we often think that sometimes passive euthanasia is not just acceptable, but maybe even obligatory. Now, you recall last time that Rachels uses this hypothetical but quite realistic case of what I'm calling the patient with throat cancer. So to refresh our memory, he says, to begin with a familiar type of situation, a patient who is dying of incurable cancer of the throat is in terrible pain, which can no longer be satisfactorily alleviated. He is certain to die within a few days, even if present treatment is continued, but he does not want to go on living for those days since the pain is unbearable. So he asks the doctor for an end to it, and his family joins in this request. Okay, so what do we have here? It's helpful to break down the options that we have. So the first option, what we'll call option 1, is that we can withdraw treatment. And this would be passive euthanasia. So whatever it is that is keeping the patient alive, whatever we could possibly do to extend the life of the patient, we just don't do that thing. Right? So if there's some way that we could extend this patient's life a few more days, a week, a month, a year, whatever the case is, option 1 would just be to not do that thing, engage in passive euthanasia, trying to make the patient as comfortable as possible for the remainder of his or her life, and then allow the patient to die naturally. The second option would be to simply continue treatment, which I'll call the life extension option. The second option here would be to do everything that we possibly could to extend the patient's life as long as we can. No matter how much suffering is involved, no matter how much the patient isn't enjoying their life or getting any real benefit from it, we're just going to say, look, we're going to do whatever we can to extend the patient's life. Now, of course, you'll notice there's actually a third option here, which would be active euthanasia, which giving the patient a lethal injection. But let's say for the moment that we're only limited to these two options. Now, the first thing that Rachel's asked you to get on board with is what he thinks is a relatively uncontroversial claim that when faced with these two options, he thinks that we'll all agree that the best option is option 1. Given that the patient is suffering, given that the patient is close to death, and given that the patient has asked for it, he says, well, for all those reasons, he thinks it's pretty clear that instead of continuing to treat the patient and extend his life, we should take treatment away and allow the patient to die naturally in order to bring an end to the patient's suffering. And Rachels explains this. He says, the justification for withdrawing treatment is that the patient is in terrible agony, and since he's going to die anyway, it would be wrong to prolong his suffering needlessly. Okay, so that's the first claim. This is a crucial idea. He says the first thing you need to get on board with to accept his argument is that passive euthanasia is sometimes acceptable, and the reason it's sometimes acceptable is to prevent further suffering, harm, and agony. Now, in order to be actually precise, I think there are actually more reasons than just that are even contained in that passage for why we would support passive euthanasia here. So, notice the first thing he says. In this case, we're imagining that the patient asks the doctor for an end to it, his family joins in the request. Suppose the doctor agrees to withhold treatment. So the first thing we notice about this case of passive euthanasia is that the patient has asked for this to occur. The patient doesn't want any more treatment. The patient doesn't want his life extended. So one thing in its favor is that we say, well, look, the patient has given consent, or the family has, where that's also appropriate and necessary. Second, as we just saw, the justification for his doing so is that the patient is in terrible agony. So the second and perhaps primary reason here for why passive euthanasia would be okay is because it prevents further suffering that would be occurring were we to simply extend this patient's life as long as possible. And finally, there's a third point here as well. In the passage it says, the patient is going to die anyway, and it would be wrong to prolong his suffering needlessly. So, in addition, the patient is close to death, and any further treatment would be essentially futile. There's no hope of making a recovery. There's no hope of making a return to anything resembling a sort of normal, or desirable life. So any further treatment is just going to seem pointless, needless, and ultimately futile. So I think we should keep these three reasons in mind. These are the three primary reasons why I think we would say that to most people, passive euthanasia would be the appropriate course of action here. So these points bring us to the second premise of the argument. Rachel thinks P1 will be relatively uncontroversial. He thinks we'll accept passive euthanasia for all the reasons he's just outlined. But P2 essentially says, well, look, if you accept that, then that has some serious ramifications for how we should also think about active euthanasia. Specifically, P2 says the following: the same reasons that support the permissibility of passive euthanasia also support the permissibility of active euthanasia. Notice how Rachels explains this. He says, look, notice this. If one simply withholds treatment, it may take the patient longer to die. And so he may suffer more than he would if more direct action were taken and a lethal injection given. This fact provides strong reason for thinking that once the initial decision not to prolong agony has been made, so once the choice has been made that we are going to bring about this person's death, that we're not going to continue their life, we're not going to extend their life, we're not going to extend their suffering, once that decision has been made, then we ought to think about, well, how are we going to bring that life about? How are we going to bring about the end of that patient's life about? And what Rachel says is that active euthanasia is actually preferable to passive euthanasia rather than the reverse. Well, why would this be? Well, active euthanasia, of course, brings the patient's death sooner. It brings about the end of suffering quicker. If we engage in passive euthanasia, if we just don't extend their life any further, then they still have to suffer out those remaining days as the disease or whatever their condition is takes its natural course. So his point is, look, if you think that passive euthanasia is okay, and you think that passive euthanasia is okay because it prevents suffering, then shouldn't that same, and this is Rachel's phrase, shouldn't that same humanitarian impulse, shouldn't that same desire to prevent as much suffering as possible, which at first caused you to reject life extension and choose passive euthanasia, shouldn't that same humanitarian impulse also make you choose active euthanasia? In support of P2, he's saying, look, if the main reason you are in support of passive euthanasia sometimes is that it prevents suffering, that same reason also applies to active euthanasia. And this is, of course, why I'm calling it the same reasons argument. And again, we should be more specific and clear about the reasons at play here. Remember those three reasons that we said justify passive euthanasia. Well, reason one, we said, well, consent of the patient. Well, can't a patient consent to active euthanasia just like they can't passive euthanasia? Can't a patient and or his or her family request to have a lethal injection just in the way that a patient might request to not have any further treatment? Reason two, prevention of suffering. Like I said, doesn't active euthanasia actually prevent suffering better in many cases than passive euthanasia? And reason three, futility of further treatment. We said to continue to further extend this life or provide further treatment would be futile and pointless, and that is going to be the case whether we bring about the end of the patient's life through passive or active means, so there's no real difference there. And so the idea here is that all the same reasons underlying our choice to say that passive euthanasia is okay also in fact make active euthanasia okay. They also apply to active euthanasia, and even more starkly, it seems that active euthanasia can even give us what we want in a more efficient way, specifically on the front of preventing suffering. Now, how might one counter this argument? One thing you might say is well, maybe I want to sort of reconsider my view on passive euthanasia. You might say, look, I accept what Rachel's is saying. Yeah, if I do accept passive euthanasia for these reasons, I guess I have to accept active euthanasia for these reasons. But can I just, retract and say, well, maybe passive euthanasia isn't okay? Well, think about what that would imply. It's certainly a position you could take, but it would just have some rather radical consequences. It would essentially mean, as we've discussed before, that every instance where you allow someone to die, whether in a medical context or not, would be just as bad as killing that person. Right, so if you are not ever allowed to allow someone to die, then again, going back to the donation and charity case, if you have the resources to donate money to someone who you don't know who will die if they don't have food or medical care or shelter or whatever the case is, and if you don't do it, then you would be held morally responsible. The thing you have done or not done in this case will be just as bad as if you had actively killed them. And this is a very controversial view. It's certainly not a commonsensical view. In fact, the consequence of rejecting the first premise of the argument and saying that not even passive euthanasia is okay means we would have to go around to whatever extent is in our ability, extending the lives of every single person as far as we possibly could, no matter if they're suffering, no matter if they're getting anything out of their life, no matter their circumstances. And that just is a quite radical position to take. And so Rachel's relies on this idea that we'll accept passive euthanasia as okay, and then just points out that the same reasons that make passive okay should also make us think that active euthanasia is okay. So the fundamental point that Rachel's is making here is that once we have decided to bring about the death of a patient, that the way we choose how to do that should be made on the basis of how do we do so as quickly, as painlessly, and with as little suffering as possible. And to further underscore this point, he discusses a case that I'll call the infants with Down syndrome case. Now he discusses the case in this passage, but I'm going to use this outline to explain what's going on here. So essentially, in the infants with Down syndrome case, what we have is a situation where an infant is born with two conditions. One of those is Down syndrome, and the other is an intestinal blockage. There's no real connection between these two, it's just sort of a matter of happenstance that the infant happened to be born with both of them. So when this occurs, what happens from there? Well, the first decision that needs to be made is, should the simple surgery that would get rid of the intestinal blockage be performed? And so why am I calling this a simple surgery? Well, the idea is it's not incredibly expensive or complicated. It has a high chance of success. And if the parents decide to perform the surgery that would get rid of the blockage, then the infant would live. Now, what Rachel says is that in some cases, parents elect to not perform the surgery. And what that means is, if you elect to not perform the surgery, is that the infant will die of the intestinal blockage. Now, of course, that decision would be quite controversial. He says some parents make that decision. His purpose in this article isn't to get into that debate. He's not going to get into the reasons he says why one would think the surgery should be performed or shouldn't be performed. It's a topic one could certainly discuss. It's just a topic that's outside of the point he is trying to make or the topic he is talking about. Instead, he's going to be concerned with, what do we do once the decision has been made not to perform the surgery? You could certainly disagree with that decision and think it's morally wrong. That's fair. But if the decision is made by the parents to not perform the surgery, that means the decision has been made to bring about the death of the infant. And that now in a medical context brings us to a second decision. Do we use passive euthanasia or do we use active euthanasia? Now suppose that we follow the conventional doctrine on euthanasia. If we follow the conventional doctrine on euthanasia, we would say, okay, well, the decision has been made to bring about the death of this infant. We know we're never allowed to engage in active euthanasia. We can't give the infant a lethal injection. Therefore, we are forced into the decision where we have to engage in passive euthanasia. And what does passive euthanasia entail? It entails doing nothing and watching a very tiny infant suffer and die over a long period of time. And so what Rachel says is that, well, this should really make us think about the conventional doctrine. And if the conventional doctrine is forcing us into a situation where we have to cause an infant to suffer greatly, we might say, well, maybe something is wrong with the conventional doctrine. Rachel tells us, the doctrine that says a baby may be allowed to dehydrate and wither, but may not be given an injection that would end its life without suffering, seems so patently cruel as to require no further refutation. Now, of course, what would be the alternative here? Well, again, if we're assuming that the decision has been made to bring about the death of the infant, then we could, of course, avoid this whole ordeal, which at some length he describes how grueling and saddening and horrifying it is for all involved. We could avoid that ordeal by simply engaging in active euthanasia. Again, once the decision has been made to bring about the death of the patient, he says, why don't we use the method that prevents the most suffering possible? Why wouldn't we use the active means of a lethal injection in this case? And so once again, what Rachel's underscores here is that what matters is not the means so much that we use to achieve an outcome, but it matters what is the outcome. How much suffering did we prevent, or how much suffering did we allow to occur? And so to that extent, you can see how Rachel's is taking a more consequentialist point of view to the topic of euthanasia. So with these points in place, let's return to the same reasons argument. Remember, the first premise says it's sometimes permissible to use passive euthanasia. The second premise says all the same reasons that support passive euthanasia also support active euthanasia. So we draw the conclusion that it's at least sometimes permissible to use active euthanasia to bring about the death of the patient. And what underlines P2 of the argument is what I would call, and what philosophers typically call, the bare difference thesis. So what is the bare difference thesis? Well, Rachel's explains in the following way. He says, the bare difference between killing and letting die does not in itself make a moral difference. If a doctor lets a patient die for humane reasons, he is in the same moral position as if he had given the patient a lethal injection for humane reasons. If his decision was wrong, the decision would be equally regrettable no matter which method was used to carry out. And if the doctor's decision was the right one, the method used is not itself important. And again, that last point there, that the method used is not itself important, is critical for understanding his point of view. What matters is the outcome of the result, not the specific means that we use to get there. And to further support this idea of the bare difference thesis, there's no real moral difference just between bare cases of killing and letting die. He uses these cases that are famously referred to as the wicked cousins cases. So let's compare these two scenarios, one called Smith and one called Jones. Rachel tells us that Smith stands to gain a large inheritance if anything should happen to his 6-year-old cousin. One evening, while the child is taking his bath, Smith sneaks into the bathroom and drowns the child, then arranges things so it will look like an accident. Jones also stands to gain if anything should happen to his 6-year-old cousin. Like Smith, Jones sneaks in, planning to drown the child in his bath. However, just as he enters the bathroom, Jones sees the child slip and hit his head and fall face down in the water. Jones is delighted. He stands by, ready to push the child's head back under if it is necessary, but it is not necessary. With only a little thrashing about, the child drowns all by himself, accidentally, as Jones watches and does nothing. So what do we have here? We have seemingly a case of two very evil individuals, right? So Smith wants to collect this inheritance and goes and literally drowns his cousin in order to gain it. And so we would all agree that certainly Smith is an evil person. But compare Smith to Jones. Jones walks into the house, has the same thoughts, I want to get the inheritance by killing my cousin, goes up to the bathroom, and it just so happens that Jones's cousin ends up drowning in the bathtub, and Jones doesn't have to do anything. He just stands there prepared to do what Smith did, but he never actually has to do it. Now, of course, what is the question here? Why are we talking about these cases? Well, this is a situation where it seems like the only difference between these two cases is the difference between killing and letting die. In the case of Smith, you have a killing. In the case of Jones, you have a letting die. And the question I would ask is, do you think that either of these should be let off the hook from a moral point of view? We would all agree that Jones is in the wrong, that Smith is in the wrong. Would we think any differently about Jones just because he didn't do anything? Well, if we look at Rachel's response to these cases, he thinks clearly not. And here's how he explains his evaluation. Did either man behave better from a moral point of view? If the difference between killing and letting die were in itself a morally important matter, one should say that Jones's behavior was less responsible than Smith's. But does one really want to say that? I think not. In the first place, both men acted with the same motive, personal gain, and both had exactly the same end in view when they acted. Moreover, suppose Jones pleaded in his own defense, "After all, I didn't do anything except just stand there and watch the child drown." Again, if letting die were itself less bad than killing, this defense should have at least some weight, but it doesn't. If Jones came to you and said, "Look, I don't deserve to be punished, or I don't deserve to be blamed in society for what I've done because I didn't actually do anything," we would laugh it off. We'd say, what are you talking about? You're just as evil as Smith. You went into the building with the same intention, with the same motive, trying to accomplish the same goal, and you just got lucky that you didn't actually have to get your hands dirty, so to speak. And the way we can outline these cases is that everything is the same about them except the difference between killing and letting die. But if we don't think that Jones is any better than Smith, and everything else is the same, then doesn't that suggest that the difference between killing and letting die doesn't matter? Doesn't it suggest that the difference between doing and allowing doesn't matter? And if the difference between doing and allowing is morally irrelevant, then isn't the difference between active and passive euthanasia morally irrelevant? If what matters is the outcome we're trying to achieve or the motivation with which we're acting, then what difference does it make whether we actually move our bodies to do that thing or we simply don't move our body and stand back and do nothing? In Rachel's view, this case shows that it makes no difference. There is no morally relevant difference in itself between killing and letting die. What matters is, what is the killing going to accomplish? What is the letting die going to accomplish? And they would say the same thing about active and passive euthanasia. What is active euthanasia going to accomplish? What is passive euthanasia going to accomplish? And in some cases, isn't it true that active euthanasia will accomplish preventing suffering better than passive euthanasia? Now, I think this is one of those situations in which utilitarianism and consequentialism in general, although a seemingly straightforward and simple theory, has some radical consequences. Right, Rachel's, as I've said, is taking more of a consequentialist view here. He doesn't think the means that you use to achieve a goal are really what matter. And so what consequences does that have? Well, first, it means we have to reject the AMA statement on mercy killing. When it says the intentional termination of the life of one human being by another is contrary to medical practice, if we accept what Rachel's is saying, well, we say, well, not necessarily. Does that intentional termination of life prevent suffering? Well, then there's nothing really inherently contradictory about it in terms of medical practice. If we think it's okay to reduce suffering through passive euthanasia, why can't we reduce suffering through active euthanasia? And maybe more fundamentally from a philosophical point of view, it's not just that we're rejecting the AMA statement on mercy killing, we're also rejecting what I would call the traditional prohibition on killing. Now, why do I say this? I just mean traditional in the sense that many people in many different moral systems have thought that there is this sort of ironclad rule against killing. And what does that rule look like? Well, something like this. It might have different formulations, but something like this. It is always morally impermissible to intentionally kill an innocent human person. Well, if what Rachel's is saying is correct, then that's not necessarily true. If we're sometimes allowed to let people die, if that's even the right thing to do sometimes, and if the reasons we're allowed to let people die are supported better by, in some cases, direct and intentional killing, then in fact there will be some situations where it is permissible to intentionally kill an innocent human person. No, it's not like he's saying this would be very often. In fact, I would imagine that Rachel thinks the situations we would be allowed to do this would be extremely rare. But the situation in which we would be allowed to do it would be the sort of situation we're talking about. A patient in a medical context is suffering very near the end of their life. There's nothing else we can do for them, and all they want is an end to their suffering. In that case, if Rachel's reasoning is correct, that would be a case where not only is it permissible to intentionally kill another human person, but perhaps even obligatory. Perhaps it's even the right thing to do. Now, in our next video, we're going to look at the doctrine of double effect reasoning, and we're going to see a different perspective on Rachel's article. But for now, I will cut this video. Thank you for listening, and I'll see you next time.